Hi, and welcome to this presentation. It is an introduction to evidence-based practice and writing the clinical question. So evidence-based practice is the gold standard in medical care. If you know anything about healthcare professionals, then you may know that the buzzword is evidence-based practice, or EBP. Nurses have been using EBP for quite some time. Physicians have started implementing such practices. PAs, PTs, athletic trainers, and even fitness professionals are also incorporating evidence-based practice into patient and client evaluation and assessment, and also patient treatment. It is important to start building this foundation for what you will be doing when you leave Point Loma. So what does this buzzword mean? How do you utilize it, and how do you write a really good clinical question? The clinical question becomes really important for the major assignment in this class, which is your literature review paper, and even in other courses within the kinesiology department. This presentation will help you to search for good, high-quality clinical research articles that can help you write a more precise and accurate literature review. So evidence-based practice, it takes into consideration the client, it takes into consideration the practitioners and their past experience, it takes into consideration research, and it brings all of these together. How does the patient feel about what's going on? What are the experiences, the clinical expertise of the doctor or the PA or the PT, of the fitness professional, and also then what does current research say? So a culmination of these three creates evidence-based practice. So your literature review paper is your final big, and I say big in quotation marks because it will be a 3-page literature review paper. So your final big assignment in this class, and this presentation and the assignment you will complete after finishing watching this video, is one of several steps that serve as a building block in writing a really great literature review paper. The first step you need to take is to choose a topic. On the screen you will see 4 topics, which I have come up with that in some way connect with most of the professions that our students are currently pursuing. Each of the topics on the screen have plenty of current peer-reviewed journal articles that are accessible from the Ryan Library, that's PLNU's library, from our database system, which you will learn about in a few weeks. You need to choose a topic for this week's assignment and are more than welcome and even encouraged to choose one of the topics you see here on the screen. However, if you absolutely know of a research interest other than one of these 4 topics here, you are welcome to choose a different topic. In the end, you will be asked to write a robust 3-page literature review paper, and this presentation will help you to find the articles that will be of most help to you. EBP is the integration of 3 different components: clinical expertise, patient values, and then the best research evidence into the decision-making process for patient care. Clinical expertise refers to the clinician's accumulated experience, their education, and their clinical skills. If you choose to attend graduate school, by the time you finish, you will have a wealth of clinical expertise. The clinical expertise is probably what comes most naturally to a healthcare provider. However, the integration of the 3 components may not come as easily and require work, which is using the best research and evidence to drive the treatment choices and to drive clinical practice assessment and how to take care of your patients and your clients. So finding out the best research evidence requires clinicians to read current research and articles on the patients they are treating, to attend conferences, and to stay up to date on best practices. And finally, patient values and preferences. So I'll give you a personal example. I played soccer in college, and our certified athletic trainers required us to take an ice bath after games and hard practices. I despise being cold, so I came up with a plan, and I just never went into the training room my entire senior year. Ever. No matter what. I was so decided upon my refusal to get in an ice bath that I didn't get treatment or care when necessary. Aside from this being a little bit ridiculous and silly, patient values and preferences need to be taken into consideration. Believe it or not, there's a high correlation between patient values, preferences, and feelings and actual treatment outcomes. My treatment outcomes as a college soccer player were at 0 because I essentially was refusing treatment. When patient values and preferences are taken into consideration, for example, one of our athletic trainers allowed me to use an ice pack instead of taking an ice bath, which I was okay with, then treatment outcomes were better. So it is important to remember that the patient brings to the situation or encounters their own personal preferences and unique concerns and expectations and values. The evidence by itself isn't the only thing that we base our decisions on, but they help in supporting the patient care process and our clinical expertise. So the full integration of these three components into clinical decisions enhance the opportunity for optimal clinical outcomes and quality of life. The practice of EBP is usually triggered by patient encounters which generate questions about the effects of therapy, the utility of diagnostic tests, the prognosis of a disease, and maybe even the etiology of certain disorders. So evidence-based practice requires new skills of the clinician, including efficient literature searching and the application of formal rules of evidence in evaluating the clinical literature. The first thing that you have to do is to ask a clinical question. Let's say a patient comes in with an ankle sprain and you begin to evaluate that patient. At the end of the evaluation, you come up with a prognosis or a diagnosis. After that, you have to ask the question about treatment or rehabilitation that you are going to do. Every good evidence-based practitioner starts with the clinical question, and that is what we will spend this presentation covering. So the first step is to ask the clinical question. The second part of this process is to search literature to find the answers that help with that question. So parts 1 and part 2 go hand in hand in your own assignment of writing a literature review paper, where you will start with a question and then you will go to the literature to find the answers to your question. The other 3 steps are steps that you will take if you continue on to graduate school, where these later phases of evidence-based practice will apply as you work with patients or clients. Step 3 takes place after you have acquired the literature. You then are able to scrutinize the literature to see how well the research was done, which is called the critical appraisal. And then you apply what you have found in the research with your patients. And then the final step is to assess the effectiveness of the treatment plan. The first critical step is to clarify 1 or 2 key issues that come up in the course of caring for your patient and to develop a focused clinical question. By starting with a clinical question and then acquiring literature, this will help you to be more successful in writing your literature review paper for our class. Having a good clinical question is absolutely one of the most important pieces in evidence-based practice and also in writing your own literature review paper. Clinicians who have curiosities and who are asking questions and who are doing a really great job with that are helping to change patient outcomes and bettering healthcare overall. So my hope is to motivate you to want to ask relevant questions, relevant clinical questions. And once you've created a clinical question, what you have then is called a PICO, a P-I-C-O. So PICO is not a word, it's an acronym. The first letter in our acronym is the P, which is our population. So let's take medial tibial stress syndrome, which is shin splints, as a topic. We could say that our patients are individuals with medial tibial stress syndrome, or a problem could be an entire track and field team with medial tibial stress syndrome. We are then able to look at patient characteristics such as gender or age, activity level, and more. The more precise that you can be in this area, the more refined your search will be and the better the research articles you will find. The next phase is what we call intervention, your eye, or the exposure. Let's go back to our example of those with medial tibial stress syndrome. What might we choose as an intervention? We could choose rest, for example, taking time off, or we could choose a specific type of rehabilitation, such as ice, or some type of treatment as well. Integration then is what we are choosing to do with the patient or the population. The letter C is then comparison. We can choose to compare our intervention to something. For example, we could choose patients with MTSS who are doing strengthening exercise to those who are doing nothing to reduce their pain levels. So our P would be MTSS patients, our I would be, or the intervention would be a strengthening program, And the comparison group could be individuals who are not doing anything. So they're actively resting, which allows us then to compare the intervention to something else. The final letter is O, which stands for outcome. What is the actual outcome in patients who did a strengthening program and those who actively rested in regards to pain reduction? Did they improve in their function? Did they return to their sport? Did they return to work in a quicker manner than those who had a different intervention? So let's give it a try. Creating a usable PICO statement using a case study approach with a topic that is not one of our 4 chosen topics, yet still applies to our allied health professionals. So our case study here, let's say that we have a patient who has carpal tunnel syndrome, which is at the bottom of the wrist. It's typically seen in office administrators who spend a lot of time typing. Let's say we have a patient with carpal tunnel syndrome who wants to avoid surgery, and this patient is asking you, the clinician, if there are other non-surgical options available that are just as effective. So we're going to use our literature search and the research to drive our clinical decision making at the end of this case study. So we need to take this clinical question and find our P, our I, our C, and our O to complete a helpful search of current literature. So we've created a clinical question. Patient with carpal tunnel wants to avoid surgery and asks you if non-surgical treatments are effective. You have heard about various conservative treatments, but are not sure if their effectiveness has been established by scientific evidence. So we've created our clinical question, and from there we need to figure out our P, our I, our C, and our O to perform a helpful literature search. So the P in this case study is a patient who has carpal tunnel syndrome. So that would be the P, and that would list patients with carpal tunnel syndrome. The I then would be the intervention, which would be surgery. So this patient is scheduled for surgery for the intervention. That's going to occur most likely when you're doing your research, potentially. The comparison, however, though, is in opposition to the surgery would be conservative treatments such as rest or massage or chiropractic treatment. These are all conservative treatments that have been used in lieu of surgical intervention in patients with carpal tunnel syndrome. And then last but not least, we have the outcomes. We're not sure if they're effective or not. This could be more specific other than the word effective. So what is effective? Reducing pain, improving function, returning back to work, being able to flex the wrist. So you have to be very specific when you're writing your PICO question. If we look at the overall case study of our P is the patient with carpal tunnel syndrome, our I is the intervention, which could be the surgery, our C is the comparison. So if we're comparing it to a conservative treatment, then our O would be our outcomes. So pain reduction, improvement in function. So now with that being said, there are ways to make these, the P, the I, the C, and the O, much better and more refined so that you yield even better search articles. So for example, my P or my population, I could be much more specific. I could say that my population needs to be of a certain age range, only looking at the literature for those with carpal tunnel syndrome who are 50 years old or older, or my population could be those who are office administrators, so I could give my patients very specific information from the literature that has to do with their job. And that would help me to narrow down the number of research articles that I would be finding. If you simply search for articles about carpal tunnel, you're going to find thousands and thousands of research articles, but if you're more specific about the type of patient that you're actually looking for and narrow down that search even more, then you have less articles to sort through later. So with our intervention, we can also be more specific, as there may be specific names for surgical procedures that have been used in patients with carpal tunnel syndrome or other treatment methods utilized as well. And then with our outcome, we could definitely be more specific too. What is it that you want to see with your surgical intervention or with the conservative treatment? So here's an example of a PICO question, which goes along with the case scenario we just went through. So by reading my PICO question, you can see that my literature search should yield me articles that pertain to adult patients with carpal tunnel syndrome, which is my P. Then the intervention and my comparison are conservative versus non-conservative surgical treatments, meaning non-operative treatments versus surgical treatments. And my O, or my outcome, is the effectiveness at reducing pain in patients with carpal tunnel syndrome. One of the great things about writing a PICO statement is that you can actually take them out of the statement and use them as search terms in your search toolbox. For example, the entire phrase, in quotation marks, carpal tunnel syndrome, becomes a search term, as well as, in quotation marks, conservative treatments, as well as, in quotation marks, non-conservative treatments. And then also pain can all become search terms, and this will eliminate research articles that do not pertain to the specific research question, which are more focused, which will help you as you write your literature review paper. Another amazing thing about PICO questions is that you can change one aspect of the acronym. Say that you're performing a search on rugby players as your P or your population, and you're not finding a lot of articles. You can then change your P to another type of population, such as American football players, or perhaps you can make it more broad, such as collegiate athletes. When it comes time to write your literature review paper, sometimes having a few different PICO statements helps you to come up with your topical paragraphs for the paper and enabling you to compare therapeutic modalities or recovery time or different populations of those you are researching. And finally, for your assignment for this week, you will be participating in a discussion board. The first thing you need to do is to figure out a topic, then to create a PICO question. You'll post your PICO question on the discussion board, and then you will need to give specific feedback to 3 of your peers regarding their own PICO statements and how they might improve their PICO question with constructive criticism. Once you have received comments from your peers, refine your own PICO statement, if necessary, based on feedback, and then you will post this in a separate assignment. Becoming an evidence-based practitioner takes work, just like becoming a good writer takes work. One of the best ways to become a good writer is to start with a good clinical question, which helps get usable search terms that are more specific and will also help you to narrow down the research and finding articles so that it will be less daunting, less stressful, and in the end, it will help you to write a better literature review paper. My last challenge to you as a future healthcare provider is that evidence-based practice is crucial to patient and client satisfaction. When we go into our professions, service is a huge part of our job. It isn't necessarily in our job descriptions, but to really serve our athletes, our patients, or our clients, we really do need to know the latest and the greatest treatments so that we can get better outcomes. Thank you for your time. If you have any questions, feel free to send me a message or an email, and I hope that you have fun creating a useful PICO question for your own research.